Hello! Welcome to the American Ambulance Aerosol Transmissible Disease Training Lecture. In this training, we will identify common aerosol transmissible diseases that present a risk in the workplace. We will also identify the levels of potential exposures of employees to aerosol transmissible diseases and discuss the difference between droplet precautions and airborne precautions. Additionally, we will discuss appropriate actions to take if exposed to an aerosol transmissible disease and discuss the recommendations for personal protective equipment. So, let's get right into it. Now, what is an aerosol transmissible disease? Well, it's a disease that is transmitted by aerosolized particles that are introduced into the air by an infected person. Aerosol transmissible diseases are introduced through tiny particles or droplets that are introduced into the air and remain suspended and can be inhaled by individuals, leading to the spread of infection. These diseases are often caused by pathogens such as viruses or bacteria, which can be expelled from an infected person through activities like coughing, sneezing, talking, and even breathing. When an infected person releases these aerosols, they can be carried by air currents over varying distances, depending on the size and nature of the particles. Smaller particles can remain airborne for extended periods and travel further, increasing the likelihood of being inhaled by others. Additionally, enclosed or poorly ventilated spaces can exacerbate the risk, as the concentration of infectious aerosols can accumulate, making it easier for the disease to spread. Droplets carrying aerosol transmissible diseases can land directly on the mucosal linings of the nose, eyes, and mouth through several mechanisms. When an infected person coughs or sneezes, they release a spray of droplets containing pathogens into the air. These droplets can travel several feet and may directly land on the face of someone nearby. Normal talking, breathing, or laughing can also emit smaller droplets, aerosols, that float in the air for longer periods and travel further distances. These smaller droplets can land on mucosal surfaces if someone is close enough, especially during face-to-face interactions. Additionally, droplets containing pathogens can settle on surfaces, and if an individual touches these contaminated surfaces, the pathogens can transfer to their hands. When the individual subsequently touches their nose, eyes, or mouth, the droplets can be transferred to the mucosal linings of these areas. Close physical contact, such as hugging, kissing, or simply being in close quarters, can also facilitate the transfer of infectious droplets directly onto the mucosal surfaces of another person. Droplets can also be directly inhaled through the nostrils and settle on the mucosal lining of the nasal passages, primarily during close face-to-face interactions or when droplets are carried by airflow towards the nose. Your eyes are another means of transmission. Droplets can land directly on the eye if an infected person coughs or sneezes nearby, or if aerosols are carried by air currents and deposit on the eyes in poorly ventilated environments. And finally, transmission could also occur through the mouth. For the mouth, droplets can land on the lips and oral mucosa during close conversations or breathing near an infected person, and activities like eating or drinking can pose a risk if droplets settle on food or drink and then enter the mouth. Droplet-type infections, including diseases such as meningitis, rubella, pertussis, mumps, the common cold, SARS, and influenza, are primarily spread through respiratory droplets expelled when an infected person coughs, sneezes, talks, or breathes. As stated previously, these infectious droplets can travel through the air and land on the mucosal surfaces of the nose, mouth, or eyes of nearby individuals, leading to transmission. Each of these diseases has distinct symptoms and varying degrees of severity, but they all share the common mode of transmission through respiratory droplets. Now, airborne-type infections, such as tuberculosis, chickenpox, measles, varicella, smallpox, and avian influenza, are diseases that spread primarily through tiny respiratory droplets or aerosols that can remain suspended in the air for extended periods. Unlike larger droplets, which quickly settle on surfaces, these smaller particles can be inhaled by individuals even after the infected person has left the area, making them highly contagious. Each of these infections can also present with unique symptoms and can vary in severity from person to person, but again, Their common trait is the ability to be transmitted through the air. Now, let's talk a little bit about some of our more common droplet diseases that we may encounter as EMS providers. Meningococcal meningitis is a serious bacterial infection which inflames the protective membranes covering the brain and spinal cord. This disease is primarily transmitted through close contact with an infected person's respiratory or throat secretions, such as through coughing, sneezing, kissing, or sharing utensils. The onset of meningococcal meningitis is often sudden, characterized by symptoms including a high fever, severe headache, and a stiff neck. Other symptoms may include nausea, vomiting, sensitivity to light, and altered mental status. Vaccination is a key preventive measure against meningococcal meningitis, with several vaccines available that protect against the infection. These vaccines are recommended for adolescents, college students, military recruits, and individuals traveling to areas with high rates of meningitis, significantly reducing the incidence and severity of this potentially life-threatening infection. Pertussis, commonly known as whooping cough, is a highly contagious respiratory disease that is transmitted through respiratory droplets when an infected person coughs, sneezes, or talks, allowing the bacteria to spread to others who inhale these droplets. Pertussis is characterized by severe coughing fits followed by a high-pitched whoop sound as the person breathes in, primarily in infants and young children. Initial symptoms resemble those of a common cold, including runny nose, mild fever, and mild cough, but they progress to intense coughing spells that can last for weeks. In severe cases, pneumothorax and an increased ICP have been documented. Vaccination is the most effective way to prevent pertussis. These vaccines provide significant protection against the disease, reducing its spread and severity, and are essential in protecting vulnerable populations, especially young infants who are at higher risk of complications. Mumps is a viral infection, primarily spread through respiratory droplets and direct contact with an infected person's saliva or mucus. This transmission can occur when an infected person coughs, sneezes, talks, or shares utensils and cups with another person. Some of the hallmark signs and symptoms of mumps include swollen and painful salivary glands, particularly the parotid glands located near the ears, leading to puffy cheeks and a tender, swollen jaw. Other symptoms may include fever, headache, muscle aches, fatigue, and loss of appetite. The most effective ways to prevent mumps is through vaccination, specifically the MMR, measles, mumps, and rubella vaccine, which is routinely administered to children in 2 doses, one at 12 to 15 months of age and the second at 4 to 6 years. The vaccine is highly effective in providing immunity and has significantly reduced the incidence of mumps. Another airborne disease is tuberculosis. Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis, primarily transmitted through the inhalation of airborne droplets, containing the bacteria expelled by coughing, sneezing, or talking of an infected individual. Additionally, close and prolonged contact with an infected person increases the risk of transmission. The disease mainly affects the lungs but can also affect other parts of the body, such as the kidneys, spine, and brain. Symptoms of TB can vary, but commonly include persistent cough, chest pain, coughing up blood or sputum, fever, fatigue, weight loss, and night sweats. While there is no widely used vaccine for preventing TB, the Bacillus calmette-guerin (BCG) vaccine is available in some countries and is often given to infants in high-burden areas to protect against severe forms of TB in childhood. However, the BCG vaccine's effectiveness in preventing pulmonary TB, the most common form of the disease, is variable. Latent tuberculosis, TB, infection and active TB disease represent distinct stages of the tuberculosis infection continuum, each with its own characteristics regarding symptoms and transmissibility. Latent TB infection occurs when an individual has TB bacteria in their body but does not exhibit symptoms of active disease. Those with latent TB are not contagious and typically do not feel sick. Diagnosis is often made through positive reactions to TB tests or imaging showing no signs of active disease. In contrast, active TB disease manifests when the TB bacteria become active and multiply, leading to symptomatic illness. Common symptoms include persistent cough, chest pain, coughing up blood, fever, night sweats, fatigue, and weight loss. Unlike latent TB, active TB is contagious, with individuals capable of spreading the bacteria through the air when coughing, sneezing, or talking. Prompt diagnosis and treatment are crucial to prevent the spread of active TB and its potential complications. Measles, also known as rubeola, is a highly contagious viral infection caused by the measles virus. It is primarily transmitted through airborne droplets when an infected person coughs or sneezes, allowing the virus to spread to others who inhale the contaminated air or come into contact with contaminated surfaces. Measles is characterized by a distinctive rash, high fever, cough, runny nose, and red, watery eyes. The rash typically starts on the face and spreads to the rest of the body, accompanied by fever spikes. Complications of measles can be severe, particularly in young children and immunocompromised individuals, and may include pneumonia, encephalitis, and in rare cases, death. Vaccination with the measles, mumps, and rubella (MMR) vaccine is highly effective in preventing the spread of measles. Chickenpox, also known as varicella, is a highly contagious viral infection caused by the varicella zoster virus. Chickenpox spreads primarily through airborne droplets when an infected person coughs or sneezes, allowing the virus to be inhaled by others nearby. Direct contact with the fluid from chickenpox blisters can also transmit the virus to another person. The hallmark symptom of chickenpox is an itchy rash that starts as red spots and progresses to fluid-filled blisters, which eventually crust over and heal. Other common symptoms include fever, headache, tiredness, and loss of appetite. While chickenpox is usually a mild illness in healthy children, it can cause severe complications, especially in adults, pregnant women, newborns, and individuals with weakened immune systems. Fortunately, there is a vaccine for the varicella virus which is highly effective in preventing chickenpox. This vaccine is typically administered in 2 doses. Additionally, the vaccine not only protects individuals from chickenpox but also helps prevent the spread of the virus within communities, reducing the risk of severe disease and complications. Protecting oneself against aerosol transmissible diseases requires a multifaceted approach, with proper personal protective equipment being paramount. Utilizing gloves, eye protection or face shields, gowns, and N95 masks can significantly reduce the risk of exposure to infectious aerosols. Gloves provide a barrier against direct contact with contaminated surfaces, while eye protection or face shields shield the eyes from respiratory droplets. Gowns protect clothing from contamination, and N95 masks filter out airborne particles, including infectious aerosols. Additionally, frequent hand washing with soap and water for at least 20 seconds is essential to remove potentially infectious droplets from the skin. After transporting someone with a suspected aerosol transmissible disease, thoroughly wiping down the patient compartment with disinfectant wipes can help eliminate any lingering pathogens, reducing the risk of transmission to future patients and healthcare providers. Here is how to properly apply an N95 mask.
The 3M 1870 Plus is a 3-panel, flat-fold particulate respirator and surgical mask. Follow these instructions each time you don your respirator in order to achieve a proper fit. Remove the respirator from its packaging and hold it with straps facing upward. Place the bottom strap under the chin panel, next to the attention statement. Fully open the top and bottom panels, bending the nose piece around your thumb at the center of the foam. The strap should separate when the panels are opened. Make certain the bottom panel is unfolded and completely open. Place the respirator on your face so that the foam rests on your nose and the bottom panel sits securely under your chin. Pull the top strap over your head and position it high on the back of the head. While holding the respirator firmly on your face, pull the bottom strap over your head and position it around the neck and below your ears. Make sure the straps are not twisted for increased comfort. Adjust for a comfortable seal by pulling the top panel towards the bridge of the nose and position the bottom panel under your chin. Place fingertips from both hands at the top of the metal nose piece. Using 2 hands, mold the nose area to the shape of your nose by pushing inward while moving the fingertips down both sides of the nose piece. Note: always use 2 hands while molding the nose piece. Pinching the nose piece with one hand may result in improper fit and less effective respirator performance. Perform a user seal check each time you don a respirator. To conduct a user seal check, place one or both hands completely over the middle panel, cupping hands over the respirator and covering it as much as possible. Inhale and exhale sharply. Be careful not to disturb the position of the respirator. It is important to have a good face to respirator seal. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the panels on the face and the position of the straps along the sides of the head and make certain respirator edges fit snugly against the face. Repeat the user seal check. Do not enter a respiratory isolation or other hazardous area where respirators are required until you are assured of a proper fit. If you have difficulty achieving a fit, review the respirator user instructions located inside the packaging or refer to the instructions on the 3M 1870 Plus Wear It Right poster to ensure that you are following the correct procedure. If you are still unable to achieve a fit, see your supervisor or a representative from the infection control or employee health and safety departments. Do not enter a hazardous or infectious area. To properly remove the respirator, do not touch the face piece. Slowly lift the bottom strap from around your neck and over your head while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body. Perform hand hygiene. 3M recommends you practice this removal procedure until you are proficient and comfortable with the procedure and before actual use of this respirator for the first time. Leave the hazardous area immediately and replace the respirator if it is damaged, difficult to breathe through, or contaminated with blood or body fluids. Follow your facility's infection control policies and procedures for guidance on how frequently you should replace your respirator. Dispose of used product in accordance with applicable regulations. Follow the proper fitting procedures each time you wear the respirator. When in doubt, review the user instructions, including the user seal check instructions. If a proper fit cannot be achieved, do not enter the area requiring respiratory protection. Follow up with your supervisor. Keep in mind that when you are wearing a respirator, it helps reduce potential exposures if the respirator fits you properly. You wear it during all times of exposure, and use of the respirator is under an effective respiratory protection program as required by OSHA 29 CFR 1910.134. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program. Or log into the 3M Healthcare website at www.3m.com/healthcaremasks.
proper fit of an N95 or P100 respirator is paramount in decreasing the risk of acquiring an aerosol transmissible disease. A snug and secure fit ensures that the respirator forms a tight seal around the wearer's nose and mouth, preventing potentially infectious aerosols from penetrating through gaps between the respirator and the face. Without a proper fit, airborne particles can bypass the filtration system of the respirator, increasing the risk of exposure to infectious agents. Additionally, a well-fitted N95 respirator maximizes the effectiveness of its filtration capabilities, filtering out a high percentage of airborne particles, including viruses and bacteria. Regular fit testing and proper donning techniques are essential to ensure that healthcare workers and individuals in high-risk environments are adequately protected against aerosol transmissible diseases. Reporting exposures of aerosol transmissible diseases is crucial for prompt action to mitigate further transmission and ensure the health and safety of individuals involved. In the event of an exposure, it is imperative to report it immediately to your supervisor or designated healthcare authority. This allows for a swift response, including assessment of the situation, identification of potentially affected individuals, and implementation of appropriate measures to prevent further spread. Seeking medical attention promptly is essential for evaluation, treatment, and follow-up care, particularly if symptoms of infection develop or if post-exposure prophylaxis is warranted. Additionally, post-exposure follow-ups, including monitoring for symptoms, testing, and counseling, may be necessary to detect and manage any potential infections early on. Timely reporting and comprehensive follow-up procedures are integral components of effective infection control strategies aimed at minimizing the impact of aerosol transmissible diseases on both individuals and communities. Thank you for participating in our aerosol transmissible disease training. Thanks for all that you do and stay safe out there.